With that, we will transition to Brian Gottschall. And as we do each week, Brian will give us an update on the COVID-19 data report for Berks County. Brian Gottschall.
Good morning, Commissioner. Thank you very much. Yes, first week of June, getting into what we all hope will be a great summer with our COVID on the decline. That starts us out with our look at cases and testing. We can see that from the graph, we're kind of back down where we were about the end of September of last year. So as we came out of the summer and our cases were starting to go up, that's about where we're at today with the blue line for our case counts smoothed for this last week. We also need to look at our testing, and the good news is that our testing numbers are staying pretty well above our case count. So we are seeing similar positivity over the last couple weeks. As our case count comes down, our positivity has been coming down proportionately. We would, of course, like to see more testing and would continue to encourage folks who have any concerns about COVID exposures or COVID-like symptoms to continue to pursue testing, even though we do see the case counts coming down so that we can continue to accurately monitor that in the community. We do see a little bit of a bump in our hospital numbers, and of course this is something we want to keep an eye on, but I don't think people should get too excited. As we've said for months now, we need to look at smooth statistics, and therefore seeing a 1 week jump in our hospital numbers is not something that we should be alarmed by, but definitely something we want to keep track of. We of course know that our mitigation measures as ordered by the Commonwealth are tapering off. We're still under the masking direction until the end of June for those who are unvaccinated. But of course, what we want to be cautious about is as we see the mitigation measures start to go away, does that result in an increase in what's going on in our community with cases or serious cases? We'll keep tuned to that and keep reporting to folks in ongoing weeks. We are still seeing periodic COVID deaths, not unanticipated, but the good news is that the line is continuing to flatten out, and that's of course what we want to see, while still recognizing that each one of those deaths is an individual and a loss to their family, friends, and the community as a whole. Our vaccine administrations continue to hold steady, with Berks being 9th by number fully vaccinated week over week. We've seen ups, we've seen downs, but we're holding firm around that 9th. We do want to draw attention to the fact, though, that we're one of the largest populated counties in the Commonwealth, and therefore it's not unexpected that by raw numbers we would be in that 9th spot. What we want to focus on, though, is the per capita numbers, and we see that per capita we are 33rd for fully vaccinated and 27th for those with at least the first dose as of May 28th. And we, of course, would like to see those numbers come up. It says that per person in Berks County, we're not doing as well as some other counties in the Commonwealth, and we would like to kind of get ahead of that race. When we look at the CDC data for the number of individuals fully vaccinated in both Pennsylvania and Berks County, we see that Pennsylvania is at about 55% and Berks County is at about 47%. Of course, the goal that has been set is 70%. Previously, that goal had two purposes. Number one, it is the accepted number that has been offered out by public health professionals for herd immunity, but it was also the number that the governor set for the alleviating of the mask mandate fully in the Commonwealth. There was an announcement in this last week that said that the governor has now set a clear date for that. June 28th is the date, and that's based on the fact that although we're only at 55% fully vaccinated in the Commonwealth, when you look at the number of people statewide who have received at least their first dose, we have crossed that 70% threshold. So that means that even those who are 4 weeks out from their second dose, by the end of June, they will have gotten their second dose. So that projects that we will cross the 70% threshold by the end of June statewide. Berks County, not quite on track to get to that same goal, and we would hope that folks would still recognize that although alleviating ourselves of the masking mandate is an important thing for all of us, I know I want to see my daughter not have to be masked in public. We also have that herd immunity goal to realize, and therefore there is still work that Berks Countyans can do. We need about 45,000 new folks over the age of 18 to step up. We put our asterisk there because the way the data is offered, we have a little variable there for the 18 and 19-year-olds, but it's around 45,000 new residents 18 plus we would need to have step up and get involved in the process in order to get to our 70% goal in Berks County. The way we can do that, we can go to doyourpartberks.com. Commissioner Leinbach just featured the website where we can find information about various clinics and locations offering vaccine around Berks County. If you don't have easy access to the web, you can call our call center and they can help guide you to one of those locations. Included in that, of course, is the county and Berks Community Health Center sponsored clinic. The Commissioner Barnhart will give some data on in a little bit, but we do want to encourage folks to think about doing this sooner rather than later, both at the clinic as well as in the homebound effort. We would like to begin saying that we're on the downside of that. We don't want to close anything down while there's still a community need out there, but we would also hope that folks in the community who have that need are going to act on that sooner rather than later, particularly that homebound piece. If you are a caretaker or you yourself are truly homebound, we would ask that you reach out to the 888 number on the screen and advise the call receiver of the fact that you need that service so that we can begin working to get our community health folks out into the field, into your house to get you provided your vaccine. With that, I'm going to turn it back to you, Commissioner. Thank you.